Hi, my name is Margaret Barnhart, and my presentation is on asthma. What is asthma? Asthma is a chronic disease that affects a person's airways and bronchial tubes. A person's airways affected with asthma narrows and swells, which makes it extremely hard to breathe. This makes the person extremely sensitive to things that they are exposed to in the environment. Here is a picture of a normal lung tissue compared to one that has asthma. Asthma signs and symptoms: difficulty breathing, a wheezing sound when exhaling, tightness of the chest, coughing, are all signs of that you may have asthma. Triggers: allergens such as mold, animals, and pollen, irritants such as cigarette smoke, changes in the weather, exercise, stress, and infections can trigger an asthma sufferer. And here's just the picture of the asthma triggers that I just spoke about. Asthma is not contagious. However, the exact cause of asthma is unknown. Facts on asthma. Anyone can have asthma, from adults to infants to children. Infants and children can develop asthma at a very young age. At times, infants and children can grow out of asthma as their lungs begin to develop. Tends to run in families and is often inherited from parents to their children. People with asthma are more at risk of developing complications from respiratory infections, such as pneumonia and influenza. So that's why it makes it important for asthma sufferers to be vaccinated. 5.4 million people have asthma. That's one adult in every 12 and one child in every 11. How to live with asthma. Asthma can be a stressful condition to manage. However, asthma should not stop a person from living a healthy life. A person with asthma must know their triggers and be able to stay away from these triggers to be healthy. Triggers and irritants vary for each individual. It may be hard at first, but once asthma is under control, keeping up with the maintenance is the key to a happy life. Many common asthma triggers can be avoided. If pollen and mold is a trigger for asthma, using an air conditioner and keeping the windows closed is an easy solution. Pets may cause problems for someone with asthma too. A person with asthma should never allow a pet to sleep in bed with them. How do we diagnose asthma? Set up an appointment with the doctor to get checked. The doctor will do a physical exam and thorough medical history, including to find out if anyone in the family has asthma. The doctor will listen to the person's lungs with a stethoscope, and then will run various tests to see if asthma can be diagnosed. However, many times asthma is not diagnosed on the first attempt. Living a normal lifestyle. First of all, avoid the triggers. Once found, asthma may be treated to be able to live a normal lifestyle. Asthma doesn't have to prevent anyone from doing what they want to do. It does not have to be a physical, social, personal, or educational barrier. Use a peak flow meter. This meter should be used every day. This meter measures how much air flows out of the lungs. A person who has asthma will blow into the meter and see how much air can be blown out of the lungs. An asthmatic person has a lower airflow than a person who doesn't. Measuring peak flow meters on a daily basis is the key to seeing problems before an asthma attack begins. And here in the corner is a peak flow meter. That's what one looks like. And also another key to living a normal lifestyle is taking the medication prescribed by your doctor. Medications come in two types: quick reliefs, which provides the quick relief during an asthma attack, and controlled medications, which need to be taken on a daily basis whether or not there are symptoms. Here are some common controller medications. As you can see, most of them are inhalers. One does come in pill form. These are rescue inhalers. They come in all different colors. And here is a nebulizer treatment. This is for more severe asthmatic cases. A nebulizer changes medication from a liquid to a mist so that it can be easily inhaled into the lungs. When to be concerned. When symptoms don't respond to medication or the peak flow drops from what is normal for that person, the doctor must be called. If asthma worsens, go to the emergency room immediately. It's better not to take chances when it comes to your health. And here's just some statistics on asthma and allergies. It strikes 1 out of 4 Americans, and you can see compared to other illnesses that asthma and allergies, there's 60 million people out there with them. You can control your asthma. Asthma is an incurable illness. However, with good treatment and management, asthma can be controlled. There is no reason that a person with asthma cannot live a normal and happy life.